And I am going to hit record on the audio in 3, 2, 1. Hi, everyone. Welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today with me, I have Dr. Seema Parmar. Parmar? Did I pronounce it right?
Yeah,
Parmar.
it's very phonetic. You're good.
Okay, good. And Dr. Parmar holds a PhD from the Johns Hopkins Bloomberg School of Public Health and is a leader with Cleveland Clinic Canada's Advisory Services, a team of physicians, wellness experts, and strategy consultants who help organizations improve employee health and manage organizational risk. And Seema, is it okay if I call you Seema? Is that
You
okay?
should call me Seema. That's
Okay,
absolutely
good.
fine.
We are going to talk about mental health, and I understand this is a huge topic. We're going to try and do this in about an hour and make it really just relatable content. I want to note at the beginning that most of you know my podcast is strictly for educational purposes only. You must see your own practitioner if this is something that we talk about that you need to investigate. This is not medical advice. So I definitely wanted to preface this conversation with this little disclaimer. And I want to welcome you, Seema. I am so happy to have you. We chatted a few times now, and I'm really excited for this talk.
Oh, me too. It's been great getting to know you, and I'm so excited to talk to your listeners as well.
Yeah. So give us a little bit of a background of your history, how you got into this field of health and medicine.
Sure. So I guess I'll start with talking a bit about public health. That really is my passion. But I think for a lot of people, when they think of public health, they think of vaccines, outbreaks, and that's kind of the realm of public health. But it's really much broader. It includes health of populations, and some of it is about disease prevention, and some of it is just about keeping us well. And for me, it's not that I think I've been in public health for about 20 years. I don't think when I was a teenager, I really knew what it was or, that it was a thing that I wanted to do. But there's a few things about it that I think have been the reason I've been drawn to it. And they're kind of very core to who I am. And so one is learning and just growing. And I think our world changes so much and so quickly. And so for me, just being able to learn and understand things that I don't understand has always been a big draw. And a lot of public health is about understanding people and understanding behavior. And that's always been interesting to me. It's the other thing that really has drawn me, I think, to things in this world is when you're surrounded by really good, kind, and really inspiring people, and a lot of folks in public health and those kinds of people that really want to have change. And then for me, there's also a big piece about just always wanting to do something that is helping people who are going through hard times. And I think for me, a lot of that came from our own family story. My parents came as immigrants. I was 6. I had 2 older brothers. Both of my parents are brilliant and educated and were very successful. And then we got to Canada, and like a lot of new immigrants, struggled to find jobs, worked minimum wage, went back to school, and things were really tough. But actually, I think for me, I had a wonderful childhood. And a lot of that had to do with having, I think, a very kind of stable and happy family, but also because we had a fantastic community of support. And I had great teachers. I had a lot of people who were around. And so it just was always in me that this is how the world should be. We should always be helping. And a lot of what we do in public health is around that. And in terms of kind of my career and positions, I think that community piece has really stayed true. And that's what's kept me in the field. So my first role, and I've worn a few different hats, Sandy, we've kind of talked about this. I sort of had a winding path, but my first role was working in an elementary school in Northern Manhattan post 9/11, working in a health program that was based in an elementary school with this pediatrician and social worker who are well ahead of their times. I think in 2001, we were talking about yoga and meditation for teachers, and we were talking about obesity in children, things that now we talk about, right?
Yeah.
But it was kind of new and wacky and wild back then, which is so fun to think about now, just how much it's come aboard. Um, and it was, I think, a great experience for me to be in this community that was really struggling. There was a lot of violence in homes, there was a lot of loss post 9/11, but it was a community that really rallied together. We had dancing, we had food, we had music, and it really shaped. And I worked with a powerhouse of, teachers and principals and docs who were really there trying to support these kids. But I think a lot of what I saw there was people trying to work through a system that really wasn't created to support them. And
Mm,
that's, yeah. And I think a lot of us can kind of see that now too in our
yes.
day to day,
Yes.
right? The interactions between systems and what we end up doing. And so that's what led me to do my PhD work. And I really wanted to understand system change. And I had another kind of really fortunate experience. I worked with immigrant and refugee women to understand their interactions with the health system. And what really came out of that was that concept of community again. It was actually more than the kind of whether or not they were getting the screenings they needed. It was, do they have social support, people who can come with them to appointments, help them with rides, help them with language. And then I got to the end of my PhD, and there were all of a sudden a whole bunch of government cuts to a lot of programs that I thought were really valued. And that hit me pretty hard. And a friend of mine had said, why don't you try management consulting? And I kind of thought, what are you talking about? Like, that does not sound like me at all. But she introduced me to her partner and some folks who were, working with a big firm, and they were doing a lot of work in healthcare. And so I moved over to consulting. And this idea here was, okay, I've done the academics, I've been in the community, but I just don't know how decisions are made. Like, how do people make decisions at the system level? And so spent about 8 years there in this management consulting field, really working with some decision makers and a lot of really good people who are trying to do good, but wrestling with the challenges of how do you think about cost? How do you think about quality? All of those pieces. And stayed there. And then when the pandemic hit, it was really interesting because all of a sudden the stakeholders shifted, who was making decisions, who had influence, and employers became a really big stakeholder, and they had not really shown up in the field of public health before. And so that's actually when I joined Cleveland Clinic, because they were doing these really interesting pieces with some big organizations that have a lot of influence on communities, on their employees. And so that's a lot of the work that we do now. And I kind of say I flipped a bit from business of health to the health of business.
Mm.
And that's a little bit of how I got to where I am right now.
Oh, interesting. Well, you've had a lot of exposure. And one of the things that actually really kind of I want to pull out of that conversation is how you're always learning. You're always changing. You're I guess fluid in your role. Would you agree?
Oh, totally. I think that's actually what excites me most of the
Yeah,
time.
but
And it's academic and people, right? You're always just learning. I love that.
I think that's key here. When you're talking about health care, whether it's preventative or actually caring once you're sick, once somebody's taking care of you, we need to constantly be up on the changes because things are always changing. And with COVID, we saw a massive change. And you and I kind of touched on this in mental health. But when you talked about it with me earlier, you had kind of hinted that it was always there. It's just that COVID might have been that whole, it just kind of all came to fruition at COVID, but it was
Yeah.
always there, right? So maybe first touch on what is mental health? What does mental health mean?
And I'll pick up on the story, Sandy, because it's so
Yeah.
true. Mental health has always been there, but I will say, even for me and in my experiences, it was always something someone else did, right? Other people had mental health concerns. Other
Mhm.
people were experts in mental health. Either, when I was in the elementary school, it was the social worker, it was the counselors. When I was doing my PhD, it was a whole other department that was mental health. And it was only when the pandemic hit that I started really internalizing that actually this is about all of us. And for me, it was probably the same thing a lot of you went through. It was, you're trying to work, you have kids at home, you have elderly parents, you're in this world of uncertainty. All of a sudden, you feel like you don't have control over things that you had a lot of control of. And I started recognizing that I wasn't myself anymore either. I was
Yeah.
exhausted. And I still don't think I put my finger on it until I started actually studying and learning and working with mental health experts. And it became really important, I think, to talk about the continuum, which is mental health. So mental health is for all of us, and it is a continuum that includes everything. I think on the one side, we really, when we talk about mental health, we also want to talk about all the things that make us healthy, all the things that make us happy and comfortable in our relationships and help us be our best. And then as we start kind of shifting through this continuum, we go through this space that we call reacting space. And this is when you start seeing changes in yourself, changes in your attitude, changes in your energy, more negative feelings. And I think what's interesting is that this healthy reacting spaces, there are things that all of us can go through. Some days you're healthy, sometimes you're
Yeah,
reacting, some hours you're like that.
absolutely.
Constant shift, right? And
Yeah.
that's okay. That is normal. But as we start shifting down the continuum and you start looking at the space around injury, so now we've talked about healthy, we're talking about reacting, now we're talking about injury. This is when you start seeing that your day to day functioning is being impaired. It's not just these kind of things that you feel and you keep going. All of a sudden, it's much harder to keep going. Maybe it's harder to get up in the morning. Maybe your relationships are starting to suffer. And at this point, this is when you might start thinking about seeking help. But for a lot of us, we don't really recognize when that point happens. But the piece that's here is your day to day start functioning being affected? And then as we start advancing down to the other end of the continuum is when we actually start talking about illness, right? And so illness can be anything that has a diagnosis with it. It's also when we start talking about things like suicidality or substance use or some of these other pieces. In the injured and illness space is really when we want folks to start reaching out for professional help, right? This
Mhm.
is when you can't figure out on your own, how do you get back to the other side of the continuum? And so I think it's really important to know that mental health encompasses all of that. And all of us can be on any part of that continuum at any point in our lives. I think it's also to know that what it looks like for you will be very different than what it looks like for me, maybe, right? Based on our biology, based on our environment, based on our experiences, based on our parents and grandparents' experiences. And so for me, when I start shifting from healthy and reacting, I know I'm irritable, right? I know I don't want to be showing up for as many things socially as maybe, I was in the past, right? For other people, it might be, I'm not irritable. I'm just not I'm just disinterested. I've started checking out, right? So each of us might look very different during this. So I think that's important. It's a continuum. It applies to all of us, but it looks different for each of us.
Uh, Can I ask you then? So some of the signs you mentioned a couple would be might be again,
Mm-hmm.
everybody's individual. And I
Yeah.
love that you say that because I'm a big believer in bio individuality. We can't paint everyone with the same brush. So I guess you could say for somebody who is normally very outgoing and then all of a sudden becomes very introverted, that might be one sign for
Yeah.
someone.
When you start seeing that change, that shift, I would say shift in your attitudes, shift in your energy behaviors, and shifts in your relationships. Those are a few kind of axes that you could start thinking about.
Okay. Okay.
Um, we'll get to sleep, but that's also a good signal. Often we
Sleep is
start
huge.
seeing changes in our sleep patterns. Like, are we sleeping through the night? And, maybe it's just one night for most of us. All of us have kind of rough nights, but when it's sustained and it's much harder, or you're in kind of chronic insomnia, these are things to be really concerned about.
And I have to note this because a lot of my listeners are women who are even menopausal.
Hmm.
So it's interesting the connection there because a lot of times menopausal women are diagnosed with depression. They have those sleep disturbances. They're not themselves.
Yeah.
And one of the physicians I interviewed, who is an expert, he's an OBGYN in the
Yeah.
US. A lot of physicians will diagnose menopausal women with depression. It is an approved drug for menopause instead of, going the
Yeah.
HRT route. So
Yeah.
it's interesting. I just want to make that connection because a lot of those symptoms of mental wellness or mental health
Yes.
could coincide with big changes physiologically for us women, especially.
Absolutely. And I said it differs kind of based on our experiences and environment, but also our biology, because we know hormone fluctuations in women. And why I think that's important is because I think often when we have these shifts, sometimes we attribute it to ourselves. Like, oh, I feel guilty that I was being irritable, or I was short and made this comment. But there are things going on that are actually not really within our control,
Yes.
that I also want to kind of give us permission and space to say that's okay and that happens.
I love that you said that. You know why? Because as somebody who had thyroid disease, oh my God, see, I could actually even get teary eyed thinking about it
Yeah.
because also, if you have something physically not working in your body,
Yes.
like severe hyperthyroidism, well, comes with that anxiety, heart palpitations, being short,
Yeah.
perhaps even a bad temper, or hypothyroidism. You can't get off the couch,
Yeah.
depression, right? So I think it's important to work with your doctor to rule out other things.
Yeah. Absolutely. And so that continuum piece, part of why we talked about it, is there's one side where I think it's important for us to all know the things that can help us with coping, restoring, getting back to ourselves. And that could also look different. And for me, I have a range of things. Sometimes it's I actually want to be around people. I want to be around loved ones. I want movie night with the kids. Other times it's like I want to be on my own. I want to
Yeah.
sleep. I want to watch a really sad movie and cry.
Yeah.
So we have a set of things that can help us navigate that healthy reacting. When we start getting to the other side, those tools aren't enough. And that's when it's helpful to seek support, right? And some of it might be some of these other treatments, right, that help with the physiological pieces. And some of it might be actually more on the mental health side and the
Right.
support there.
So I guess what you're saying there is,
Hmm.
kind of rule out work with your doctor to rule out
Yeah.
other possibilities. But then what can happen, obviously, is either those things aren't ruled out or things just get worse and you need to seek help.
Yes.
I want to ask you, do you know, I'm not sure if you'd know this offhand, do you know if the suicide rate went up after COVID?
So let's talk about this because I think
Yeah,
this is a really important piece. And
I
and I
agree.
and I think we have, in some senses, thought that we've really opened up the conversations around mental health, and that's great. But there's some things that I think are still really hard to talk about. And suicide is one of those,
Yes.
and is one of the ones where often there's this feeling of what could we have done
Mm,
before, right? So in terms of rates, if we look from with Canada and the US, we see slight different trends. In the US, actually, 2022 hit record levels of deaths by suicide, more than any previous year.
mm.
And a couple things is one, when we look at men, the number of deaths are 4 times the number of deaths in women. However, women do have a much higher rate of suicide attempts, right? So there's a piece there.
Okay.
The other thing that is a trend to watch is that it's also in older adults now. So we're seeing rising rates in elderly as well. So the highest rate of suicide in the US was actually in those 75 and over.
Wow. I didn't
which
know
is,
that.
and I think it's just showing that across the spectrum, there's different things people are dealing with that maybe we need to consider. In Canada, it's been different in the sense that we didn't see a spike in suicides, but we have seen impacts in other places. So, for example, we've seen the rate of deaths due to unintentional injuries, which includes suicides, but it also includes things like overdoses. And that has gone up, right? And so there's a piece around not just where people are mentally and whether or not they're able to get the support they need, but what are the types of coping mechanisms people are using when they're not supported with help,
Mm.
with professional health or social community support.
So Canada saw a rise in addictions and deaths as a result of overdosing.
Yeah. So and the overdosing, you know, across we have the opioid crisis and those pieces, but it sort of opened this idea that um, drug substance use is more pervasive now and not always well managed.
Mm.
And there's much higher risk in the types of substances people are using. And these are all things I think from the public health side of me are things that, you know, they're preventable. There's some things in the world we can't prevent, but there's some things per world we can if we can equip people with the right information and supports, right?
Yeah, because I actually talk about that a lot on my platform is numbing,
Mm-hmm.
right? So, I mean, would you agree that that's an obvious cause for a lot of these substance abuse, like alcohol? Did we see a rise in that? Just even overall
Yeah.
usage, there and Seema, it's interesting because you see on TikTok, this is when it kind of started like this trend
Yeah.
of let's just go and down a bottle of wine and it's almost like that became normal.
Yeah.
Maybe it was always happening, I don't know, but it's like a big trend. Like you would even see people would make memes about it and
Yeah.
girls night and it was all middle-aged women,
Yeah.
right? So
So recently, Canada has put forth revised guidelines for alcohol consumption. And a lot of it was anchored in looking at the literature over the past several years to see what's out there and to actually put forth recommendations on it. I think the thing that has been interesting is part of it has been something like what you just said, the use of alcohol as a coping mechanism versus the use of alcohol as a social part of it, which then means you're starting to hear more daily drinking, right?
yes,
And
yes.
some of those pieces, right, rather than just social drinking. But it's also just caused, I think, a lot of us, whether it's individually in our social circles, whether it's with our the organizations and clients that we work with, to revise how we talk about alcohol, how we introduce it into social activities or social functions, and some of those pieces. And it was like it's when you start seeing substances being used as a coping mechanism, um, you know, to deal with underlying issues that require other supports, we do want to care. We do want to be thoughtful about that, right? And so I think on the substance use side, there's lots of reasons why we're seeing more kind of toxic substances and why they're leading to death. And same thing, a lot of reasons are a combination of people's environments and experiences and how they react and all of those pieces that are there. But there is something that I think we need to talk about, which is what are the tools people are using and are they healthy? Are they beneficial? Are they really helping you get back to the other, to the healthy reacting side of the continuum versus to the injured ill side of the continuum?
I actually recorded a podcast about this not long ago, just specifically for middle-aged women,
Mm-hmm.
because there's a big difference, and I love that you said that. You made it very clear whereby I've always personally been about balance, but I understand that we are not all the same, and sometimes balance is difficult to achieve for some people in certain areas. And there's many reasons for that. But even if you look back, well, when we were living during COVID times, that was not balanced. So it was,
No, it was not.
right. So if you think about that, it's like all of that blew up because
Yeah,
people were at home and they're like, what am I going to do? I'm sitting here working
yeah,
with my husband over there and my kids are doing schoolwork in that
yeah,
corner. And so it was a really weird time for
yeah.
everybody.
And you start thinking about okay, what are the little treats I can do for myself? What are the little things I can do? And then I think now we're starting to say, okay, let's revisit what we think those treats are,
Yes.
right? And how often we go towards those treats, because some of that treating became habit, right? And some of these things you don't see in the immediate, but you see in the long run. And so really creating that awareness and being attuned to why and for what reason,
Yeah.
you might be leaning towards substances. This is not an all or done thing by any means. It's just for each person thinking about that.
Each person, absolutely. Because I personally, I use my excuse, not my excuse, my own personal example of me being an ex-smoker.
Mm-hmm.
I am not able to dabble in smoking. Back then, when I used to smoke,
Okay.
I loved it. And I saw that it was a coping mechanism for me. So I
Mm-hmm.
get stressed out about this at work. I go have a cigarette. I get right. So it was 100% a coping mechanism and it was an addiction. So I had to break it personally. So this is
Yeah.
why I like that you say everybody's different and everyone is a unique situation as it relates to any substance. Like I can easily say, Seema, I'm addicted to my one coffee every morning. Is it harming me? Is it harming my relationships? Is it in balance? Is it a coping mechanism? Not really, maybe a little bit. But do you see what I'm saying? So
Yeah. It's
weighing it.
that. And the questions you just ask yourself are that point when we say, do you need extra, like, do you need to be seeking support?
There
Is
you go.
when it starts impairing your functioning and your relationships. So when some of these habits start making it harder to get up in the morning, harder to show up and work, harder to be yourself, harder to, you know, keep those relationships that you really value, that's when we want to be thinking about, are we actually getting the support we need?
I have a question, and I'm not sure if what you think of this. Do you think that some people might have experienced some sort of PTSD from COVID?
So maybe we'll change that, because PTSD has some very
Okay.
unique and let's just talk about grief or loss,
Oh,
right? Because
okay. What about trauma?
I think trauma has its own dimensions as well. But the
Okay.
reason I say grief, and this was really interesting to me how we position this, is because grief isn't, often we think about grief as the loss of a loved one, but grief occurs for many, many reasons. So there is grief that your child did not have the experiences you hoped that they would have had. There is
Interesting.
grief because, the way things used to be will never be that way again. There is grief because maybe you're a different person now than you were 3 years ago. And so I think there has been a lot of grief and a lot of loss that has happened that we all haven't necessarily tapped into, that we might be experiencing, and how that's impacting how we show up today. Um, I think that we're seeing that even in clients with kind of shifts in working structures, but you also see shifts in teams. The people who used to work, maybe before you'd come every day and you had that person that was sitting next to you, and now you don't have that team dynamic. So there's a lot of, I like using the concept of grief and loss in some senses, because I think there is some part of us that we've all kind of gone through during the pandemic where there's been some grief, been some loss.
Hmm.
Trauma, I think I want to be careful for, just because there are a lot of people who have different experiences of trauma, and I don't really want
Yes.
to, dilute that experience. and what those needs might be.
That makes sense. And I can speak from personal experience hearing the word trauma, right?
Mhm.
The word trauma, saying, "Oh my gosh, like I'm hearing this and it sounds like it's going to happen again." It's like trauma and fear. Is this going to happen again? Is this
Yeah,
going to happen again? And it's almost like that fear that it's going to happen again, that we're going to
yeah,
be locked down, that there's going to be another pandemic. And that raises, I'd say, a lot of fear in a lot of people,
yeah.
whether, you had major issues from the lockdowns or whatever, it's going to raise that fear.
I think it's the fear, but it's also it's a sense of a lack of control. I think for a lot of people and many of us, you could put things in, you did a lot of things and you were able to shape a lot of pieces of your life. And then all of a sudden, this thing happened and it wasn't really in your control. And all of a sudden, there wasn't that much even in your life
Yeah.
that you could control. And so I think going forward, what's happened for a lot of us is you have that, it's a fear, but it's also a bit of a hesitancy of what's next, what's that uncertainty that's coming. How do we actually move forward if we don't know what's going to be happening in the future? And if what we do today, how that might manifest in the future, right?
Mhm.
Um, so there's a lot of emotions that I think the pandemic evoked for many people. And I think we're still processing and learning from a lot of that.
Mm. Do you think that our, as a society, our mental health has worsened since the pandemic, or do you think that maybe we're just talking about it more?
I think that, and we kind of touched on this before. So, as a society, there were a lot of things happening related to mental health even before the pandemic. I think the pandemic, and what I mean by that is that, you know, any of these experiences, whether it had been, stress from work or loss of, a loved one or any of these pieces that we've talked about, all of those things were still there
Hmm.
before. I think the pandemic really opened up conversations and awareness around it. I think seeing whether it was a celebrity or a leader step forward and start talking about their mental health was really important. It helped people feel a bit more normalized in it to say that, yes, it's okay for all of us to struggle. I think there's still a lot of things, like we said before, that we're not talking about, be it, I think it's still very difficult to talk about bipolar
Mm.
disorder or schizophrenia. I think it's still really hard to talk about suicide. I think it's still really hard to talk about substance use. So I think it's opened up conversations, but I think we're still, a bit scratching the surface on are we truly getting to some of the mental health challenges that have been in our society all along, and are we really um, helping the folks who need the most support get that support.
Yeah, we touched on this privately when we talked about some of the really public suicides. We talked about Twitch,
Mhm.
and I mean, I don't think I know one person who didn't, find that beyond shocking and sad, and nobody understood it. And, even we were saying, like, our children, my daughter was shocked, and we were all shocked
Yeah,
because the appearance, and that's what I think is probably the scariest thing for people who are not struggling, is that we may not see that somebody's struggling.
right. And that piece about, so I think the something that was really interesting that came forth when we think about the pandemic and when I look at the public health angle, but then I start translating it to some of the conversation we're having now, is it's this idea of warning signals,
Yeah.
right? Of there's so much to talk about, all the warning signals that the pandemic was coming. There's so much people can say about what was reacted to and what wasn't, all those things. I think that's true in our own lives as well too. But I think what is hard is that there's differences in experiences and differences in what we see for other people. So it's equally important to know your own warning signs as it is to also be seeking out for other people and knowing I think sometimes we see warning signs and we say, okay, I think something was different with that person, but we couldn't quite put our finger on it. We just let it slide. And this is by no means me commenting on the situation with Twitch, but what it really, I think, evoked for all of us is like, there are people who we think may not be struggling because they show up, as happy and fantastic and kind of thriving in the world, and we don't know what's going on behind them. And likewise, maybe we do that the same for others. So how do we know our own warning signs, but how do we also, proactively, when we see something that might be, a warning signal in someone else, we're stepping in to actually provide that support and help out. I think it's really hard to comment on kind of one person's situation and what happened when we don't know the full context and we don't know what's going on. But I think
Right.
it made a lot of us reflect on ourselves. Are we okay? And then the people around us is, everyone, even the people who seem to be doing really well, let's just think, and take a moment to check in and say, are you really okay? Right.
I agree. But I also think we have to be careful because sometimes, as I'm sure you would see in your line of what you do, you have to be careful because if that person is really closed off, you could potentially
Mm-hmm.
risk your relationship with that person, right?
Absolutely. And I think it brings up, this is one of our learnings, I think, as well in the last couple of years, is that when we worked with clients, mental health is so top of mind that it was just we started, having a lot of conversations with a range of organizations, bringing in our psychiatrists to help facilitate these conversations, just to really open up the dialogue and reduce the stigma around kind of mental health broadly. I think what we're learning now too is you have to equip both sides of the conversation. So as we start talking about it, the people who are hearing about it also need tools to help respond and help engage, right? So if someone is talking about self-harm openly to you, that is very difficult. And not all of us are equipped to have those conversations. That's not something you're kind of just generally trained on, right? And there's risk to both people on that side of the conversation. So I think you're absolutely right that we need to not only open up the conversation to make people feel more comfortable talking about it, we also need to open up the conversation on how to handle it when someone
Yes.
is speaking to you about these concerns. And the other thing that I think is really important is, what can you do about it? Because that's a really hard part for people, is you want to help.
Yeah.
How do you connect to resources? What resources are out there? And accessing and getting support for mental health is very different than physical health. So, one of my clients, she said, I felt like I was kissing a frog until I finally found that person who really worked and helped me. And
Mm,
so it's not, because of the kind of vulnerability and sensitivity that's involved in those relationships with the mental health, professional or support, someone who's providing you support, it might take some time to find that fit. That's very different than when you go in to get your finger x-rayed, right? And that you need to get it done. So I think understanding how to access it. The other thing is treatment plans aren't
mhm.
clear for everybody. So it's not easy to say, hey, why don't you go do this for someone? You don't actually know if that's the thing that works, right? There's a lot of finding that fit of professional, of therapy, of medication, all those pieces. And all of this to say is, if I could advocate for one thing, is advocate for yourself and don't give up, because it takes time. But also, when you're the support person for someone who needs that kind of help, it's not on you to be their professional therapist, but you can help to say, hey, maybe it's okay to keep going, or maybe we try someone else, or how do you speak up to get that help that you need? So those are a few things that we're working on. How do you kind of decrease stigma and get people to talk about it? How do you equip people with resources and language when they're the person being confided in? And then
Yes.
how do you help people understand the existing support system and resources that are out there, and how to navigate that whole, you know, mental health professional service system?
I think what you said there is really important. There's a lot of things that you said that were really important. There's two sides to the coin, especially if you're a parent. So, as an example, when my daughter was sick, I had no idea how do I talk about this with a
Mhm.
5-year-old and a 9-year-old? How so Toronto's Hospital for Sick Children, amazing. They had child life therapists.
Yeah.
So I actually use that service because I'm like, this is so foreign to me. But, obviously you take their advice and you use your own intuition as a
Yeah.
parent, because I'm a big believer in everybody has a different parenting style, but get some advice from somebody who knows how to deal with these situations. Just like what you were saying about self-harm. Like I wouldn't even know where to start on
Yeah.
trying to help someone. But if I'm a parent of a 5-year-old, I
Yeah.
want my child to trust me, but I better get some advice from experts as well in the
Yeah.
situation.
I think the other thing that's also important that we're learning there is those individuals who are on the receiving end, there's an experience for them as well too. So there's risk, but there's also, like, I've talked, um, we talk to managers, for example, who are on the receiving end of multiple conversations like this. We talk to call
Yeah.
center employees, we talk to frontline employees that are on the receiving end continuously. And why I bring this up is, if you are one of those people, you need to take care. You need to give yourself permission to take care of yourself too, because this is affecting you too, right? So,
Absolutely.
you know, there's multiple layers. Make sure, we want to reach out and support people who need care. We also need to advocate for ourselves, but we also need to see that when we're the caregiver or we're the support, we might need help as well.
I like that you mentioned that, because I think we forget that a
Yeah,
lot of the
right.
time, especially when we're parents. We forget that. Um, okay, let's get into what we can do. We talked a lot about signs and how they're different.
Mhm.
What I loved is that you talked about self-awareness. When you see you're different, like, I can recognize things, but sometimes it's in hindsight, right? Like you don't see
Yeah,
it until you kind of come out of the fog. But what if you don't come out of the fog?
yeah. So a couple things. And I think these are some of the things that did come from the pandemic where we need to kind of be aware of this. So one, um, in terms of the things that we can do, it's easy to say know your warning signs, but sometimes it's hard when you're in the midst of it to know what your warning signs are.
Yeah,
There are a lot of things on, mindfulness and journaling and all of those pieces. And I think one of the things I want to say about why those can be important is they, even just taking those few minutes, it actually helps you be more attuned and alert to you,
I love
right?
that you
So
said
when
that.
things start shifting, you can feel that something is wrong. Because when we don't give our space to do that, that's when we start feeling like we're losing touch, right?
Yeah.
So there are some very small, simple things that I think are just important so you can keep aware of that. And then if you know something is different, then you give yourself that permission to say, okay, something's off. I need to step in. And maybe it's just those, you're hanging out with your friends, you're, taking that night to sleep 8 hours with everything, disconnected, whatever it is you need to do for yourself. But that's really important. I think that the other thing is that, and this term kind of, so mindfulness is a big term that's come out a lot. Another term is resiliency. We hear a lot about what that
Yep.
means. And that's been a really interesting one for me to try to unpack in practice and what it means. And there's a few things that I think are important, when I think about that. So one, resiliency means being able to bounce back when you've fallen, right?
Yes.
And
Yes.
so that's that part about, bouncing back. But I think part of it is also giving yourself permission to fall, because that is normal, right? To make mistakes, to stumble. And it's hard, I think, especially with young folks today who kind of have a lot of things kind of visible via social media or all of these pieces, who missed a lot of those experiences during the pandemic to kind of stumble and pick themselves up. Actually, it is something you need to think about, to say, it's okay to fall, and I'll do that sometimes, because if you don't, when you fall much harder, and it's a lot harder to pick back up. So just even in that visual of, give yourself permission that we all stumble, so that when you fall, it's okay, right? Because I think we forget to say that's okay,
Yeah.
these days, right? The other piece is when we start thinking about bouncing back, there's a piece that's individual, and we've kind of talked about this, about what are the things you can do to build those reserves of energy so that you can bounce back up, right? So all of the pieces, it's a lot of the things that you talk about in your lifestyle work as well, Sandy. So all the sleep, the nutrition, the physical health, all of those pieces are part of building your reserves of energy, because if you're depleted, it is really hard to bounce back. So once you
Yes.
fall, it feels like you're crashing, right? And so giving yourself that permission to also build up your reserves, I think, is really important. And in that, it's all the kind of healthy things we talk about. It's also just the things that make you happy, the things that give you joy, all of the anything. And it could be different for all of us. It could be, I think we talked about, it could be dancing in your kitchen, right?
Yeah. Yeah.
Yeah. Like all of the,
Absolutely.
right? Like, playing a game with your kids, all of those little kind of happy things. I think that's really important. I do feel, and I wonder, because I've noticed it with my kids, that we had a couple years where, people were masked and they didn't see anybody smile. And
Oh,
when
yeah.
we opened doors, we didn't say, hey, hold the door open for that person. We said, okay, keep your distance, keep going.
Yes.
And I wonder, have we lost some of that just kind of happiness? So that's that second thing of building your reserves of energy, but just joy, right?
Mm.
The third thing, and I mean, this kind of points back to why I sort of went into depth with my stories, that kind of community piece. I think community just so matters. And, you know, you look at society, you look at history, you look at different cultures, that how do we support each other is really important, right? And we did lose some of that sense of community. I think when the pandemic started, everyone kind of riled up, and we were all like, you know, everyone sort of felt like we're going through this collective thing together. And then it started separating, and we started seeing more divisions and more reactions. And that feeling of collective community, of how do we help each other out with all these little things, um, that's really important, because none of us can do this alone. And I can even say for myself, all those failure moments in my life, I know the people who are there and what they said, and some of it, changed my life, right? And so, how do we build back and just really reconnect with everybody in our, in our existing circle, but also the other people who are now in our lives. I talk about how sometimes it feels like we're forcing disconnection rather than connection when we talk about the divisions and how people feel, right? And what we see in social media, what the
Oh,
streams are,
there's a lot of divisiveness. Yes.
all of that. So how can we lean towards connecting when we see differences rather than disconnecting? So those are some of those pieces when we talk about action, that they're not revolutionary. I don't think I've told people things they don't know, but it's something that I think I constantly want to remind myself about in my world, but also that I just think is so important. And I think we sometimes forget.
Yeah, I love that you mentioned all of it, because whether or not, listen, so there's going to be a lot of people that are going to listen to this podcast. They know who you are, they know your credentials, and they're going to take that to heart. So I think it's important to repeat these things regardless. And the whole divisiveness, like instead of community, I so align with that. because we saw so much of that separation in all ways, in every way, through social media, through people, through physical, through, and it's like, oh, well, you said that. And, I can't align with you. And I like, there's just so much of it. And community is so important, and prevention. And one of the things that you mentioned, journaling,
Yeah.
I have to just reiterate that you don't have, so I am an English literature graduate. Okay. I like to write, and you don't have to like to write to journal.
No.
And exactly what you said, it brings things to mind that otherwise could be buried in that busy day where you're getting the kids ready for school, and
Yeah.
then it's this activity, and then you got to make dinner. And then it's like, oh my God, I've been scrolling for an hour on TikTok, and it's 10 o'clock and I got to get my sleep. And you see, I think when people don't stop and actually just be quiet, you speak about mindfulness, and so many people will say to me, well, I can't meditate. I'm like, well, neither can I. That's why I use tools like I use Brain Tap, I use Newcom. And what it is I tend to have that brain that goes in all directions through the day. And
You
so
and me both.
but we recognize that about ourselves, that if we don't stop for however much time you can give, whether it's to write, whether it's to use a tool like I have to use, I tried doing other things for meditation. These work for me. And you got to find what works for you, just to get
Yeah.
that brain to slow down. And then all of a sudden you might be like, okay, I'm not okay. And I
Yeah.
haven't been okay for a while.
Yeah.
And maybe it's time that I reach out and get some help, because it's been a while that I haven't been like this, but I didn't notice because I just kept going and going. And then, no judgment here, but going and then masking through numbing like alcohol or
Yeah.
whatever else. And we get on that hamster wheel, right?
Totally. And I think the piece of advice that was really great for me is when you're journaling or thinking about those pieces, write about the good stuff too, not just the
Mm,
bad stuff. Write about the
yeah.
high as well as, the other parts, because there's something about revisiting those moments that just reminds you, right? It's at that balance piece we talked about, right? This isn't every day, right? It's there's just having both of those pieces in there, I think is so important.
Okay, I think we need to see, because I know it's going to be different in the US than Canada, but who do we reach out to? So there's in Canada we have Bell Let's Talk. We
Yeah,
have
so that's a
we have a number.
campaign, right?
That's a camp. Like,
And
tell me how all that works. Where do we
yeah,
go?
yeah, absolutely. So very recently in the US, they launched it, and now we have it in Canada as well. There's the 988 suicide helpline,
Okay.
right? So that's new. And the idea was that just 3 digits. Don't give me a long toll-free number, just give me 3 digits that I can text or I can call to get help, right?
Okay.
So 988 versus we have our 911, we also have 988. So everyone should know that both across the border. I think we're going to figure out how to, get that running and make the best use of it. But that's a very good resource just to know off the top.
Can I ask you, so that resource is for anybody, whether it's somebody who's afraid that someone they know is suicidal or doing something that could potentially really harm them?
Exactly.
It could
Yes.
be
And it
for
could be for
anybody.
yourself. It could be for
Okay.
seeking support for someone else.
Okay.
The folks on the other end are trained professionals that can help direct you, as needed.
Okay.
And it's text and phone. It's English and French in Canada. I think it's multilingual in the US. I don't know the full range of languages there as well. But that's a tool that just came up recently that I think, we want to just normalize and make sure folks have out there,
Yes. Yeah.
right? Um, on the seeking professional, there's a lot of pieces locally. There's a lot of Sandy, I'm happy to kind of share a list if you want to put it up in your
I
blogs
can
about
put it
some of
in
the
my show
national pieces.
notes. Yeah.
Yeah, right. And there's a range, and it's interesting because it's there are, culturally sensitive resources. There are resources just for men. There are resources for youth, right? It's kind of depending on what you need. Um, and so I think that's also important because I think I said before too, mental health is a lot less structured in some senses than some of the physical health pieces that we can think about normally. And so trying to figure out the right fit and what's meaningful to you, having a range of different resources that you may feel more comfortable with is important.
Can I ask you a question about that? Does that mean that somebody could use one of those numbers and find, let's say, if it's applicable, a psychotherapist or a psychiatrist, or yes or no?
A lot of them will have kind of counselors, or they will have folks that they can refer to. I think it's important to actually know, though, that there are a range of mental health professionals out
Yeah.
there, right?
Yeah.
And we may not all need a psychiatrist, right?
Right.
There's a
Right.
range, and we may find fit with different types of professionals as well. And so what's good with a lot of these resources is they have multi kind of disciplinary teams, right? But they're
Okay.
teams that specialize in certain populations or supports.
Okay.
And so it's good to it's a lot like it's easier to access and know who some of these folks are if you're going through kind of a specific organization. And you can get that help as well, right? A
Okay.
lot of organizations now, like employers, they have supports in place as well. I think that the kind of more challenging part is figuring out what support is most appropriate for you. So there's employee assistance programs that depending on the program itself, have a range of different resources. But there's also different tools, like you talked about some of the meditation tools. There's things related to cognitive behavioral therapy. Like there's online programs. There's actually a range of things that are out there. And so it's just becoming kind of familiar with that. But I can give you some of the ones that we have looked at that are specific to different populations as well.
Oh, that would be great. So are these like 988? Is there a fee for that?
No,
No,
no.
neither in Canada or the US. There's no.
No, it
Okay.
was the idea that, like, exactly what you said, what do you do when you're in this
Yeah.
situation? And 911 wasn't the right answer,
Right.
right?
Right.
And so how do we, and then folks on the other end of 911 may not also be equipped to answer these questions, as we talked about earlier. And so that's, where the oranges of 988 came from.
And people who do answer those calls, they can all, is it specifically for suicide?
It is, but there's also everything that kind of comes up to suicide. Like I will say, if we talk about some of the numbers. So in Canada, I think the rates are around 4,500 suicides per year. But if you look at the number of suicidal thoughts, the most
Oh,
recent stats I saw, it's about 840,000. That's almost a 200-fold difference, right? So yes, suicide, but there's a whole range of reasons, when we start thinking from thoughts right through, where someone actually dies by suicide, right? So it's covering a lot of ground, I think, there.
that's huge. What about internet? Because Cleveland Clinic is international, correct?
Hmm.
So are there resources? Because I do have some listeners in Europe.
Yeah.
And, I don't know if there's resources in Europe as well for the Cleveland Clinic like I would just like to say that this conversation is so important. I want to put as much information in the show notes as I can.
Yes. Yes. So Cleveland Clinic, we're in Canada, we're in London, we're in Shanghai, we're in Abu Dhabi. They're most, I would say suicide has become such like it has been raised in terms of priorities that many governments, including the and the WHO kind of broadly, but many governments are actually making this a priority, right? And so it's not just that you go to a single system. Like in the UK, they have a new strategy around suicide as well. So in each country, there are things that are going on based on the rates and what we're seeing there as well too. And it will look different. There's other kind of nuances around credentialing of mental health professionals in some of those pieces. And so I don't want to kind of assert what might be happening,
Yeah.
in other countries there as well too. But I think it's important that when something that happens to an individual becomes a public health issue, then it's something that affects all of us.
Yeah.
Right. And it's a global public health issue at this point. Right. So you're absolutely right
Yeah.
that, this goes beyond Canada and the US.
What would you say is the one common denominator that we've seen as it relates to mental health from across the world? Or is that a really tough question?
Uh, it's a tough question, and I'll probably put a disclaimer around, what I think,
Yeah.
right?
What? No, but it's just like, what do you
Um,
think? You're in this industry, so it doesn't necessarily have to be a definitive stat.
yeah, I would say so. I think you start feeling angst when you have an expectation of what you think something should be, and then life or reality falls short. So that gap between reality and expectation, and somehow across the world, maybe it's because of internet, social media, all these pieces, we've our that gap seems to have been increased. And I don't know if it's because we've changed where our expectations come from of other people, of institutions, of ourselves, right? Or, we need to, like, I don't know if it's lowering our expectations or just recalibrating reality on that. But there is something in that space between expectations and reality and acceptance,
Mm,
right? That is just part of life, right? That there are, for centuries, the world has gone through hard times, and for centuries we've been able to come through it. And, how do we just kind of bring back that this is life, right? Like, part of the expectations of life is that there will be things that are struggles. And part of what we know
yes.
is those tough times also really lead to, many good things afterwards. Um,
Yes.
so I don't know if that's really the answer, but like, there is something in my mind about, I feel like these expectations and reality, there's some kind of miscalibration that's causing angst in society right now.
I think what you're saying makes so much sense. What the reason is, we can't quite
Yeah.
pinpoint yet, but we can surmise a few things. Like I almost think, I hate to say it because it probably sounds almost cliche now, but social media is a big one because we see the lives of so many people. It's almost like too much information coming at us,
Yeah.
and it may not be accurate information and
Yeah.
reality information. So it's
So
almost like
that's
a
a really
distorted.
interesting piece. Yeah, because I think another big part of community and connection is trust. And
Mm,
if you can't trust information and you can't trust people, it makes it very hard to then figure out, okay, am I doing the right thing?
mm,
And I think the challenge with I think there's a lot of good things that come with technology and
yep.
social media by all means. I think it's really sparked this kind of grassroots movement in many areas, which is so important. And I really value giving a voice to people who may not have a voice. And I think it's really created that, which is great. I think I worry that we may not all be seeing the same information. And that actually forces some of that disconnection and divisiveness, right?
Mm,
Because then it becomes really hard to have trust in others, also to have trust in your own knowledge and
mm.
judgment as well, right?
Yeah, I love that you say that. I actually talk about that because, I'm writing a book right now. I talk about
Mm-hmm.
critical thinking and being able to
Yeah,
really kind of decipher, okay, this applies, this doesn't apply,
yeah,
and being able to move through all this information that's coming at us.
yeah,
So
right.
we live in a world of information right now,
Yeah, a
right?
world of information and maybe not that much understanding.
Yeah. Yeah.
So
Yes. Well, okay. Is there anything that we didn't touch on that you would like to mention that we didn't cover off? This has been a great conversation, Seema.
Uh, We've covered a lot of ground.
We have. We have.
I think like maybe just probably like recapping some of the pieces around like what I have learned that has been so helpful for me that I hope others can experience as well, is that understanding of the continuum and that acceptance of trying to that we all may be on different parts of that continuum in time, and that's life and that's okay. But how do we recognize our own warning signals? How do we feel comfortable seeking support, early and as needed? And some of that might just be in our community and social circles, but some of it could be professional as well. And don't give up, right? When something is warning, when you have that warning signal and something is off and it's affecting you, just don't give up. And sometimes I think we talked a little bit about this with the caregiving too. I think we forget that other people want to help us too. Like,
Mm,
we all feel there is a joy that comes from helping other people. So it's okay to say I need support, and it's okay to reach out to people also.
I love that. So where can someone find the Cleveland Clinic? Is it just tell us a little bit about the Cleveland Clinic?
Yeah. So Cleveland Clinic is an amazing institution. I'll say be biased, but I think the things that people don't often realize about us is so we're large. We're based in Cleveland. We have over 70,000 caregivers, which is, how we refer to our employees. And um, it has a very interesting story, which resonates a lot with me personally. It started, after the war, with four doctors who'd worked together abroad, and when they came back to the US, kind of said, hey, we actually do better as a team in terms of patient care than we do individually, so why don't we come together as a team and look at that model of care delivery? And so that idea of kind of team-based multidisciplinary care, and the importance of not just kind of the service, the quality of treatment, but the patient's experience, is very, very core to who Cleveland Clinic is broadly. Now, how we show up and what we offer in different geographies looks very different. And in Canada, we're a real I'd say we're a complement to the system. We really try to support where there are gaps. So one big part of the work that we do is around employers, as I spoke about, and some of that is more direct patient care. Some of it is more advisory services, which is the type of work my team does, where we really connect doctors and experts across this kind of multidisciplinary, team of physicians and other clinicians and public health experts to really help our clients or organizations navigate some of these issues. So we have that part of it, but we also do a lot of the community, whether it's testing or vaccines or any of those pieces that came up during the pandemic. And we also have a sports medicine side as well too. So it's
Mhm.
all these kind of different pieces that are there. But I do think there's a lot that folks don't know about the type of work we do and how we support.
I will definitely put the website on in my show notes along with all the other resources we talked about. And I really want to thank you. And it was such a pleasure meeting you,
Oh,
Seema.
thank you so much, Sandy. This has been great. And
Yes.
and thank you for just having this podcast and a forum for people to learn and to share experiences. I just think that's it's a community, right?
Yeah, exactly. Thank you, Seema.
All right. Take care.
I actually press stop. Let me press stop
Okay.
there.